All right. Well, thank you everybody for being on the episode today to focus on mental health. We have Joe French with Child and Adolescent. Hello, Joe.
Hi, Amy.
We have Allison Esber with Starkmar.
Hi, Amy.
Hello, and Michelle Smith with Coleman Professional Services.
Hello.
Hello. Well, we are here to hear from you, to hear exactly how you're coping with the pandemic, maybe some needs within your organization, how you're working together. So I'm going to start there.
So we provide primarily services to children and youth and young adults. So our services are typically for kids, like I said, from 0 to 24 years of age. And we're throughout Stark County, as well as a couple other neighboring counties for some specialized services. But that's kind of our role in this community, is to provide mental health, behavioral health, and we also are doing some substance use work recently. And so we're kind of expanding some of those services, again, primarily just for youth, young adults.
And you're in the school system, right?
We are. We provide school-based consultation to 8 school districts. We're in over 55 school buildings, providing mental health services directly to students while they're in their school day. So if something comes up during the day, they have access to a mental health professional immediately.
So Starkmar is Stark County Mental Health and Addiction Recovery. So we are the County Behavioral Health Board that is enacted with funding, providing federal and state funding, as well as our local levy to organizations in the community who are providing those direct services to our community members. So we contract with Child and Adolescent, Coleman Professional Services, and a number of other different organizations in the community in order to so that they are able to provide services to anyone in the community, regardless of their ability to pay.
We provide 24-hour services 7 days a week. People can call, so we operate the Stark County Crisis Line. So anybody who's having a behavioral health crisis or just feeling distressed can call 24/7 and speak to a counselor. We also have counselors on site. So if anybody is struggling in their home and they need to come in and talk to someone, they can walk into our office. And we also have 2 mobile teams, a mobile youth team and a mobile adult team, and those are counselors that respond to the community. So if an individual is at home and is in distress and can't get to our office to get help, our counselors will go to them. And then lastly, we have what's called a crisis stabilization unit. And individuals can come. It's for someone who needs some help coping with symptoms, doesn't quite need the level of care of a hospital, but needs to kind of get away and receive some treatment for up to 2 weeks. And they can come and stay. And we have counselors and psychiatrists and nurses on staff as well.
So definitely has changed the way we deliver service. We have seen typically our programs have been about 60% right now is telehealth. Prior to COVID, I would say that it was next to 0%. Most of our services were delivered face-to-face. And so we really had to get creative in how we deliver those services. And so our staff will do whatever it takes to continue to provide excellent clinical services to our clients in whatever format they feel most comfortable.
One of the things that we've been really focusing on is how can we support the agencies who are providing those direct services, making sure that they have all of the technology needs that they need to have in order to do that telehealth service. I know Joe mentioned that most of our organizations weren't doing telehealth before just because of some of the restrictions around that, and COVID has really allowed that to happen, which I think has been great for a lot of organizations, and it eliminates some of those barriers that a lot of individuals may have as far as transportation and childcare and those type of things and getting to some of their appointments.
Initially, we did see we saw a decrease in people accessing services in person. So the middle of March to probably the middle of April, we saw a real decrease in services face to face, but we have seen an increase in our crisis calls. So not only the Stark County Crisis Line, but we also are one of the providers for the National Suicide Prevention Lifeline, and we've seen an increase in those calls. So typically we do about 5,000, we receive about 5,000 calls a month, and probably a third of those would have been what we called like crisis calls, where we had to do a little bit more intensive counseling with people. And that's really increased. It's about half now that they're more intense calls that we're receiving.
I'm really concerned about the fact that, there's 50% of our kids are not 50%, but 50% less referrals for abuse and neglect. And that's not because it's gone
Right
down,
now,
but because,
Bill?
I'm sorry?
Right now, you mean?
Yes. So
Okay.
the reports for child abuse and neglect has dropped in Stark County by 50%. The reports. That doesn't mean it's not happening. It means that people are not accessing the child. The child's not in situations where somebody can report. And I really, that's a huge concern. But at the same time, what I'm thrilled with is the fact that people are reaching out for services more frequently and more readily than they have in the past. As Michelle said earlier, I think our numbers are definitely starting to go up because people are reaching out for those services.
Is there any particular mental concern or struggles that the young ones are going through right now?
Sure. I think the biggest thing that we're seeing is anxiety. I mean, big anxiety and borderline depression. I mean, really starting to look at, especially from a young child's point of view, is why can't I touch that person? Why, I'm used to going up to my friend and giving them a hug, or why can't I go over to their house, and why can't they come over to my house? And so they don't always have the capacity to understand that dynamic. And not only that, but then as you get into, middle school and high school, again, lots of outlets like sports and dance and things like that. And all those things were being taken away or, getting canceled. And then they don't have the outlet that we encourage them to do, those pro-social activities. And if they don't have those outlets, then what am I going to do with this anxiety? What am I going to do with this depression? And it's really been a challenge. But again, our therapists are what I call Stark County community heroes, just because they're the ones out there trying to give them, the hope that tomorrow's going to be better, and we don't know what it's going to look like, but it's worth living. It's worth trying.
Yeah, I think one of the positive things that we've seen since we aren't providing direct service is really the flexibility, creativity that our providers and all of our community partners have been able to adapt and really meet the needs of the individuals and the clients that they're serving in Stark County. I think that speaks volumes to the work that our system partners do, and that they are truly as willing to do whatever it takes to meet the needs of the individuals in the community. And I think that is wonderful that we have such wonderful partners in our community.
Yeah. How about you, Michelle?
I think I touched upon it a little bit, but collaboration, just community collaboration among us partner agencies. One of the examples is when this first hit, the emergency rooms pretty much shut down to everyone. And our counselors typically go out to emergency rooms to do assessments. And so, I had multiple team meetings with Altman IT to get WOW carts installed so my counselors could do telehealth with the ED patients. And so that never would have happened before, or it would have taken a year, and it took 2 weeks. So the collaboration that I've seen in this county to serve our community has been amazing.
I think the access to care. I think everybody's mentioned the importance of, before there was the kind of obstacles around transportation, especially for us, because you have to keep in mind that most of our clients are kids and they don't drive. And so they rely on a secondary person to get them to their appointments. So it could be the school schedule or the work schedules, whatever the parents may be going through. But having to be able to use telehealth, which we weren't able to use at one point, really has opened up access to service. And I really think that that's been a huge positive.
I know a lot of folks are spending a lot more time at home. Their kids may be home a lot more as well. And so we really do encourage people, making sure that their home is safe. We have resources on our website, making sure that, medications are secured safely or disposed of properly, firearms or other potential things that may put a young person or even another adult at risk, that those are secure. This is a great time to do that since we are home a lot. The other couple things that I'll mention as well is our coalitions, our Suicide Prevention Coalition, our Drug Free Stark County Coalition, our Opiate Task Force are all still continuing to meet virtually. And we are always looking for community members and community partners to participate in those because their feedback, ideas are instrumental in moving this work forward. Mental health and behavioral health is not just something that we as professionals do. This is kind of, as Joe mentioned, everyone's responsibility. We all have a role in this and making sure that people get the help that they need when they need it.
The biggest thing I would communicate to the community is just to call. If something is concerning about yourself, about your child, about your neighbor, about your family member, call and get help. So calling a provider agency or calling our crisis line at 330-452-6000. These are really unusual times that we're all dealing with. And so something out of the ordinary could be, something minor, but it could be something really significant. So just being mindful to, how kind you are being to others and how you're doing and how others are doing, but really being able to reach out for help and guidance if you need it.
One of the things that I would say to the community is just be nice to each other, be kind. And again, if you see somebody that's struggling and really needs some help, encourage them to reach out. There's still a minor stigma to reaching out for mental health services. Let's eliminate that. Encourage people to reach out and call and say, hey, I know of a great agency that can get you connected. And maybe you don't need it for a very long period of time, but at least you'll be having somebody that is talking to you in a non-judgmental way and giving you really sound techniques to use long-term in your life. And what a gift to yourself. And so that would be my advice to the community. Can I add one thing, Amy? I also think that Start Community Foundation and all the foundations like Sisters of Charity coming together and doing that COVID fund was a huge positive. I mean, really think about the collaboration, as Michelle said, from a funder's point of view, to really rally quickly and get the dollars turned around quickly to agencies who had to all of a sudden, be doing a different type of cleaning, and the need for the PPEs that just was overwhelming. And I think all of you coming to our aid, really, when we were scared, we were just as scared as anybody else. It's a huge positive, and we want to say thank you for that as well.
Absolutely. Of course, it's our community and our donors are so generous. I think you just touched on it, all of you. We live in a unique community. Collaboration, dollars, time. We're in an environment like no other. We care. We all care whether we know each other or not. So it's super nice. But thank you for saying that, Joe. It was a great effort, and it still continues for all those organizations that have needs going on.